Hello, I'm Dr. Lipi Roy, and welcome to my show, Health, Humor, and Harmony. Imagine these scenarios. You're injured at work, you fracture your leg in multiple locations, you're taken to the OR immediately, you then develop a rare life threatening infection called necrotizing fasciitis. You then undergo a total of 17 surgeries to not only save your leg, but to save your life. Through it all, you're dealing with tremendous pain. Well, imagine no longer, because today I'll be talking to Alex Smith, former NFL quarterback with the Kansas City Chiefs, about his harrowing ordeal with injuries, hospitals, mental health struggles, resilience, and pain management, including his pain game plan, partnership with Vertex Pharmaceuticals, and much more. Let's get started. Well, greetings, everyone. I'm Dr. Lipi Roy, and I have the privilege and honor of interviewing National Football League quarterback Alex Smith. Alex, how are you?
Dr. Lippy, I'm doing so good. Thanks for having me.
Can't wait. I mean, my God, as a practicing physician who has worked in emergency departments, in hospitals, inpatient settings, and in intensive care units, I'm somebody who's very familiar with life-threatening infections. We're going to get into all that. I will say something that I know you've already heard, Alex, but based on knowing what severe life-threatening infections you've had, you are lucky to be alive.
No doubt. Unfortunately, I hit all those departments that you've worked in, unfortunately,
Oh
on
my
my
God.
journey.
You've been so brave and so courageous and open and vulnerable in sharing your story. I'm just going to dive in. And my first question for you, Alex, can you just share your story of that initial leg injury? I believe it happened in 2018, and the
Yep.
subsequent intervention, treatment, surgery, and complications.
Yeah, I'll try to keep it quick. Yeah, November 18th, 2018, my alive day, as they call it. Yep, I had a compound fracture of my tib fib, a spiral fracture from my knee to my ankle. I went into emergency surgery that night because of the spiral nature of my break. I was not a candidate for a rod, so I had three plates, 30 some odd screws put in my leg. I woke up the next day to good news that the bone was well aligned. Surgery had gone well. That is the emergency surgery that was the day of my injury. I needed to stay a couple days for observation, and then I could go home. I never made it out of the hospital. Uh, Infection set in. I had a really rare, some multiple really rare bacteria that were present in my leg that turned into what's called necrotizing fasciitis. It's a fancy word for flesh-eating bacteria. Um, and went into subsequent debridements for over the next 2 weeks, basically every single day. Um, Woke up 2 weeks later with half of my lower leg gone at this point from cutting out the infection, and was really faced, at that point with a choice of trying to fight to keep my leg, which would involve a lengthy process and multiple surgeries, known as limb salvage procedures, to try and save my leg, or amputation, which would have been at the knee at that point. And for me, obviously, this was a life-changing experience, unexpected, which is so often the case in life for everybody. And obviously, it's something that has changed who I am in so many ways. And so, yeah, and obviously, it was a crazy couple-year process, and somehow I ended up running back out on the field and playing quarterback again, which was insane given where I was at that point.
I mean, what an incredible journey that is and story you've had. Uh, Remind me, Alex. So the accident happened pardon me, the injury happened on field during an
Yes.
actual game,
Yep.
live game. So first of all, this is all happening on air in real time in
Yeah.
public. So that's another element of just complication and scariness. But remind me, how old were you when that happened, the injury?
I was 36 years old.
So
Oh,
28.
Sorry, I was 34 years old. When I came back, I was 36. I
Yeah.
apologize.
So you're 34 years old. So just so viewers and people out there understand. So a 34-year-old man, elite athlete, you're extremely healthy, okay? Injuries, most in sports, most people think of musculoskeletal injuries, but they don't really think about, and we're going to talk about this too, like the mental health and the
Yeah.
emotional, psychological aspects of the game, which
Yeah.
is again something you really talk about. And by the way, your TED Talk was fabulous. I encourage everyone to watch it. So we'll talk about that too. But so you are somebody who's from a physician standpoint, perfect kind of candidate for a surgery. Your chance of having a good outcome are extremely high. And
Yeah.
even then, you got not only an infection, by the way, post-op infections are common. You got probably one of the rarest and really, when I say life-threatening, just so folks understand, and probably you've never thought you'd say the terms necrotizing fasciitis this much
Nope.
in your life, right, Alex?
Nope. Nope.
As a doctor, it's something I don't say very often. So, okay, so you had this infection. Thank you for also allowing us to see some of those photographs of this harrowing injury. I saw the x-rays. You had multiple fractures. I believe you
Yep.
also had an open fracture of the bones on,
Yes.
right?
Open fracture of
Yeah.
the back of my calf. Yeah.
For those who don't know, that also increases your risk of infection. So you've also been pretty public about just, and this is why I would love for you to share just that post-op journey and the recovery. I can only imagine. I know for a fact patients that go through what you did struggle with extreme pain. So can you talk about what that was like, just not only but physically, and then of course emotionally, mentally, how that impacted you and of course your family?
Yeah, I mean, I think so often, especially in sports, but this is for everybody, and I think especially in orthopedic medicine, all the focus was on my orthopedic journey and the steps and the potential outcomes. And certainly so many of my questions were on that, right? Like, what did I need to do? What could I get back to? What level of ability did I have left? And all the attention is on the physical. And for me, I was so unprepared for the mental journey that I was going down. And that doesn't get talked about so often in medicine. And so much of that for me, especially while I'm talking to you today, had to do with pain, right?
Yeah.
All of a sudden, again, I was on top of the world that morning. And that night I was in emergency surgery in the ER. Um, and obviously faced with at that point, a couple year journey to try and recover and pain. And, it affects everything,
Hmm.
right?
Yep.
It is so front of mind. It fogs and debilitates how we all engage with the world, right? My ability to be a dad and a husband, let alone try to recover or try to get out of bed and try to go to work, how is completely affected by pain. And
Yep.
this is something that is so personal
Yep.
and yet so universal, right? I
Yep.
mean, again, playing professional sports, mine was very public, but this is something that we all deal with,
Yep.
right? As we live life, it's not a matter of when, or not a matter of if, but when
Right.
these things happen to us. Sometimes they're planned, like surgeries, but more often than not, it is something that is unexpected.
Yeah.
And so for me, I really enjoy opening up about these. The trials that I went through, the mistakes that I made, the battles that I had, because so often these things that aren't talked about. And again, pain management being a big one of these. I remember when I finally got discharged from the hospital a month later, the last 5 minute conversation was, oh yeah, go by the pharmacy. I got bags full of pain medication and a rescue med, right? And my wife and I are terrified. We don't know how to handle any of this. We haven't had a conversation about our plan going home, how to handle sleeping, how to handle active moments, right? Again, my mood, it was debilitating and it was so
Yep.
scary. And again, if I could go back, the questions that I would ask, the conversations that I would ask, but I was so scared to have those, right? I
Yep.
think we all know at this point, the ramifications of the side effects of some of these drugs, especially the opiates, even some of the over-counter medications, the NSAIDs. And I was afraid to have these conversations and for me, kicking myself about it. So really encouraging people to go have these conversations, drive your own ship. It is so personal.
Yep.
It is such a part of the process.
Yeah.
My physical recovery, how I engaged in my recovery was directly correlated with like how I handled my pain. right?
Yeah.
And it again changed over the course of a day. It changed day to day. And so these are things that so often are taboo in this
Oh,
country, but these are conversations that need to be had. There are more options out there. I encourage people to go have these conversations. Go to my game plan, mypaingameplan.com.
yeah.
Check out some of these things that are out there again, because times have changed. I wish some of these options were available back in 2018, and again, encourage people to have these conversations with their care team.
Well, this is why I love meeting and collaborating with people outside of my own profession, people like you. You're the star athlete. You weren't trained medically, although I must say you probably have more medical knowledge now.
Unfortunately,
Forget most doctors, forget most athletes, most doctors too. But this is why I love hearing these stories because I'd like to think it makes me a better doctor, a better communicator. It sure as hell makes you a better at understanding your health and then using your platform, both of us using our platforms to really educate and empower the public. You talked about pain. I'll be really honest, Alex. I've had the privilege of going to great medical schools, medical training program. I learned very little about pain management and probably zero about addiction. And now I'm in my day job. I'm an addiction medicine doctor who deals with pain and mental illness and the pain and trauma and suffering that act as risk factors to people developing substance use disorders. But the general public, as you pointed out many times, pain is it's very subjective. It's also very objective too. But we need to, as medical professionals, need to really personalize or tailor our treatment plans. I'm assuming, Alex, but I don't want to, shouldn't make an assumption, but I've seen images of your leg pre-op, post-op, all the blisters, the pus,
yeah.
sorry, not to gross anyone out.
Oh,
But it was really graphic what was happening. Was your pain, was it like a stinging pain, a burning pain, throbbing, dull? How would you kind of describe that?
yeah, unfortunately, I had close to 20 surgeries, and they were all so different, from free flaps. And for everybody out there, they moved part of my left leg, my left
Yeah,
quad down to
yeah,
my right calf in order to save it, to skin grafts, to debridements. I wore an external fixator, which again, a fancy term for this
a
steel
cage.
cage
Yeah.
bolted to my leg. For close to a year, I wore that. And
Wow.
so like life goes on, right? Again, I'm a husband, a dad. I'm trying to recover from this injury. I went to weddings with this metal cage on. I danced on dance floors with open tensioned wires and screws bolted into my leg, right? Like I had a PICC line to my heart because I had to be on obviously all these antibiotics with these open wounds. And again, all of these things that were talked about in great detail. However, again, my pain and how to cope and deal with this, those weren't. And again, it affects everything. Like, I
Yeah.
was stuck in a wheelchair for months, and I was not in a good place mentally
Yeah.
at that point
So
at all. I was
I'm
so
a,
confined and
yeah.
depressed, and again, that affects how you engage, and obviously dealing with pain at that point, right? And it's so hard, especially when you're limited physically. For my at that point, that the pain it overwhelms you, right? You just kind of marinate in it, and it's hard to escape. And so, again, just for again, this is part of the process, and you feel so alone when you're in it. I think that's the thing. You feel
Yeah.
alone. I felt guilty as a patient asking for relief, that I was uncomfortable. I think we all take pride in trying to be tough and get through these
Exactly.
things,
Right.
and I felt so alone. And I think that in hindsight, looking at it, it's so funny because it's like it is so universal, right? Like these are things that we all deal with, and they're conversations that should be so front of mind.
Right.
And it is such a part of the physical journey is the mental journey, and pain management being such a part of that.
Well, thank you so much for being so clear in terms of like what that process was like for you. So for people to understand like the steel cage, to be able to live with that, and you're still trying to be as functional as possible, the pain that you were dealing with, and if you were in a wheelchair, my God, it sounds like this was just a long journey for
Yes.
you. And there were like ups and downs. When you say, just so our listeners understand, that bag of pills and the rescue medication, I'm going to assume that was naloxone or Narcan, which is a reversal agent against
Yeah.
opioids. So it
Yeah.
sounds like you received opioid painkillers, So for those who don't know, those are like oxycodone, Percocets, Vicodin, Dilaudid. There's a whole bunch, morphine, whole bunch of medication that fall into the class of opioids. But you also mentioned NSAID, so that would be like an ibuprofen, Advil. But you got this whole bunch. It sounds like you weren't really, neither you nor your wife were really given like all the pros and cons, the side effects, how to manage it. It's Pain is really complicated and it
Yep.
needs to be tailored to each individual. Some people have acute pain, others have chronic pain. Most people have a bit of both throughout the course of their life. You might be able to see I have like a rotator cuff
Same.
tendonitis, so I'm
Yep.
going through physical therapy, but my doctor and ortho gave me pain meds. So I'm doing massage, I'm doing TENS, which is electrical stimulation.
Yep.
That's just one example of me, and I'm a doctor who has some level of knowledge, but for the average person, they don't have that information. So my question for you, Alex, based on your just incredible journey, what advice, like what message would you convey to the public and
Yep.
medical professionals about pain, both acute and chronic pain, based on your journey?
I think one is that it is so universal, right? I think people need to understand that. Don't feel ashamed about it, right? Again, it is so human. I think the other thing is to have these conversations. So again, I go back to my experience. Discharged from the hospital, again, on our way out, you swing by the pharmacy, bags of medicine, and I don't want to get into the name brand, but like you name it, we got it. And then you're given a rescue medication and you're scared and you're given a pamphlet this thick on all the potential side effects. It's not a conversation. You don't understand it. For my wife and I, personally, we were so scared. We had heard horror stories about addiction and some of these side effects. It was kept under lock and key. Again, I felt guilty asking for them at times when I was dealing with pain. And again, it is so personal, right? Like how I felt in daytime was so different than trying to sleep at night, right? Like how I
Yeah.
felt before my rehab versus after was so different and it changed day to day. And again, these are conversations that need to be had. So for me, the number one takeaway again as a patient is that I wish I could go back and engage in these conversations, that you drive this process. Go create a game plan, a pain game plan for yourself with your care team. Make sure you're asking these questions. Don't be afraid, I think, to have these conversations. There are more non-opiate options available today. I
Yeah.
wish they were available back then for me. Again, this needs to be a part of the process, the healing process. And so really advocating for people to go do it.
A message for medical professionals like me?
Oh, I think same thing. I mean, I think realizing that some of this is gray, I think you hit on it. It can be gray. It can be hard to have. But I think starting that conversation
Yeah.
uh, as a, as
Yeah.
a doctor is so important. Again, I think so often it was just an afterthought or uh, something hard to talk about and deal with. It's not comfortable to talk about some of these things.
Yeah.
But I think starting that conversation and keeping it open is probably the biggest step.
And advice I give to patients, family friends, family members who say, I went to that doctor and they weren't really helpful. I didn't, and I'm like, well, if that's the case, then get a second opinion. Trust your instincts. If
Yeah.
you think something doesn't feel right, doesn't look right, doesn't sound right, ask somebody else. Like you mentioned this several times now, Alex. Ask questions, be
Ask.
proactive. And it sounds like what you're doing is what I do for a living, which is empower patients, empower the public. Oh, really, I tell my patients all the time, you know your health better than I do. So I'm asking you questions so you can better educate me so I can in turn give you the best possible clinical advice. Does that make sense?
That's exactly right. And I think so often, again, as patients, at least for me personally, I know this feeling. You get overwhelmed. You don't want to sound stupid. You don't want to ask a dumb question. There are no dumb questions. It is
There
your
are
body.
none.
It is your body. It is your life. It's your recovery. Speak up. Again, you're not expected to know these things. I think these are all universal feelings that we have. And again, to be able to move beyond them, it really empowers patients.
I have one last question. This question is actually from my brother, who's now my brother, unlike me, I'm a hockey fan. He's a huge football fan. And when I told him I'm interviewing, he's like, oh my God, you got to ask him this question. So this comes from my brother, Neil.
All right.
So, look, Alex, you become like this symbol of like fortitude and resilience because of based on your journey. Not to mention you were playing in the NFL as a quarterback for like what, almost 15, 14 years. So, given what you've experienced, what advice would you give to people who face adversity that really isn't sports related? You know that most people face challenges in
Yeah.
everyday life.
Yeah.
So, the people that are facing that kind of adversity, whether it be unemployment, health issues, other like family trauma, whatever. What advice would you give them based on your experience?
Yeah, I think in this country we love this idea of kind of rugged individualism, and I think this idea of resiliency, and that no one does anything great alone.
Nope.
Nobody. I
Accurate.
I am the product of some amazing teammates and teams that changed my life and still changed my life. Most of all my wife and family, but certainly my care team, the folks in the military that changed my rehab with my leg. And so for me, I think leaning on them when you need them, lean on your team, seek them out. Certainly, obviously, here we're talking about your care team, and I think when you are dealing with an injury, with pain, lean on them. Again, I can't emphasize that enough. No one does anything great alone. No one overcomes anything difficult alone. And for me, um, listen, I never expected to be the athlete I'm on the crazy injury video, highlight video, right? Like that's me. I had the crazy injury. I never expected to be there. Um, and for me, but that's part of my story, and certainly, uh, has revealed things in me that I didn't know I had. And I think we're all stronger than we think. And again, but it's not. And I guess for me too, it's not all sunshine and flowers. Sometimes there are dark moments, there's hard moments, and again, that's natural. And
Yeah.
and again, I think pain, obviously, here being a part of that
Yeah.
mental journey.
Well,
But yeah,
yeah, I would never say that's a right answer or a wrong answer, but that was an excellent answer. And especially coming from my field, my line of work, where a common motto is the opposite of addiction isn't sobriety, it's connection. So
yeah,
this idea of like just because it certainly in my world, there's so much shame and guilt associated
yep,
not only with substance use, but also mental illness, depression, anxiety, PTSD. The pain, asking for pain, being accused, or you're a drug seeker.
yep, yep,
All of the you're just being weak, gotta toughen up. And I gotta say, in your field, in sports, pro sports, male dominated, I mean, these are all the kind of check marks for not seeking help and care because then if you do you're perceived as being weak and not being tough enough and so thank you. I mean, Alex, by sharing your story, I'd like to think that we're both really destigmatizing and reducing that stigma and fear, and encouraging people to get help and just ask for help. I do that all the time.
exactly. I think you said it perfectly. Again, hopefully. And I think that's kind of yeah, again, I mean, you said, again, football player, trying to be a tough football player. And for me, I fell into that. I tried to live up to that. And again, it didn't work. It's so unhealthy. And for everybody out there, again, these are universal things. We all have our ups and downs. Life comes at us in different ways. And so it is so great to connect on these things. It's such a shared experience, and it should be front of mind, and these are conversations that we should be having.
I love talking to athletes. I recently launched a series called Health, Hockey, and Leadership because a lot of things that you talk about, Alex, same journey experiences a lot of the pro hockey players
Yep.
and NHL players that I talk to who are now executives, coaches, whatever. So I cannot thank you enough, Alex, for talking about your story, sharing your story so publicly. Again, people should watch Alex's amazing TED Talk, many articles written about Alex's journey, but it starts with you, Alex, by openly talking about it and sharing this journey. Is there anything else that I didn't ask or that you want to share?
Yeah, I mean, I think most importantly, for anybody dealing with pain, certainly coming up here, summer months, the weather's getting good, everybody's going to be outside. Like, unfortunately, injuries are a part of it, right? Life, like we talked about. Go check out paingameplan.com. There's a ton of information out there. There's so many options. This will help people spur conversations that they want to have with their care team, things they should be thinking about. Again, helping them steer these conversations. a bunch of resources there. So anybody that needs it.
Alex, thank you so much. And just to emphasize, pain, yes, it can be really simple, like a little like splinter, or it can be really, really a lot more complex. It affects your emotions, mental state, psychology, all of that. And
Yep.
you've been so open about sharing your story, Alex. I'm so grateful. Thank you so much.
Dr. Lippy, thank you for having me.
You got it. I am so grateful to Alex for sharing his story, for being so vulnerable, transparent, and authentic. You should watch his TED Talk. It's very inspirational. As I mentioned in my conversation with Alex, I have taken care of patients with severe life-threatening infections that worsened into sepsis and septic shock. With immediate intervention, including IV fluids, antibiotics, and pressors, and sometimes surgery, as in Alex's case, patients can survive. But not all do. Necrotizing fasciitis, or flesh-eating disease, is a rare but serious bacterial infection that moves rapidly through the tissue under your skin, known as fascia. It's often caused by group A streptococcus or staphylococcus bacteria. There are about 700 to 1,200 cases per year. Up to 1 in 3 people die from this infection. Treatment must happen stat. Exploratory surgery to confirm the diagnosis and remove the dead tissue. Some patients require multiple surgeries, as Alex did, to control the infection, as well as skin grafts and plastic surgery to close the wound. IV or intravenous antibiotics and IV fluids are also often required. Pain is often misunderstood, misdiagnosed, and undertreated or inappropriately treated. For all these reasons, I am so proud of Alex for sharing his story. Everyone's pain journey and experience is different. The source of the pain, type, duration, complications, and therefore treatment all differ and should be tailored to that patient and his or her pain. Many get better with non-medical interventions like ice, heat, massage, stretching, exercise. Others benefit from over-the-counter medicines like ibuprofen or acetaminophen or Tylenol, topical or pain creams. For others, stronger painkillers are indicated, such as opioids like oxycodone or morphine. As a physician, my advice is to talk to your doctor, who should then perform a comprehensive evaluation and may refer you to a specialist if necessary. Untreated pain can lead to many other complications and truly disrupt your way of life, leading to mental health issues and many other problems. Get help if you're in pain. It's available and you deserve it. Before we go, here's your joke of the day, football themed. Why do football players never wear glasses on the field? Because it's a contact sport. Well, that's all for today. Be sure to subscribe to my YouTube channel, write comments below, and follow my Instagram at Health, Humor, Harmony, Dr. Roy. Be well, and I'll see you soon.